Hello, my name is Jack Ma, and today I'll be talking about a new surgical procedure for treating glaucoma. So first we'll start with the function of the eye. The human eye provides us with the invaluable sense of sight, allowing us to perceive our surroundings by taking in and processing reflected light from objects around us. The human eye works as light reflected off objects enters through the cornea, which focuses the light. Then the pupil controls how much light enters the eye. This light is then focused by the lens of the eye onto the retina, which transforms this into neural signals, which are then sent to the brain via the optic nerve. The aqueous humor is similar to plasma and predominantly made up of water, but also contains vitamins and nutrients essential to nourish the cornea and lens of the eye. Along with providing nourishment, the aqueous gives the eye its shape by maintaining a healthy intraocular pressure. So what is glaucoma? Glaucoma is the most common disease causing irreversible loss of vision, with around 300,000 Australians having the condition. Glaucoma is the group of diseases where vision is lost due to the optical nerve being damaged. The onset of glaucoma is gradual, and generally people lose a considerable capacity of their peripheral vision before they are diagnosed. The most common way the optic nerve is damaged is by a high intraocular pressure, caused by a buildup of aqueous in the eye. The pressure which can cause damage to the nerve varies from person to person, and there is no set level where damage begins to occur that is applicable for everybody. In a healthy eye, the aqueous will drain through the trabecular meshwork into the canal of Schlemm. However, the meshwork can become blocked over time, leading to a buildup of intraocular pressure. Over time, this increased pressure places more stress on the optic nerve, damaging it. Existing treatments. Currently, there isn't a cure for glaucoma or a way to regain lost vision. However, there are a number of treatments to slow further degradation of the optic nerve and maintain what vision remains. Most current treatments focus on reducing intraocular pressure. Initial treatments will use medications, which may come as eye drops or oral tablets, which allow for increased aqueous drainage or decreased aqueous production. Unfortunately, these medical treatments sometimes come with some serious side effects like headaches, allergic reactions, drug interactions, and can cause other complications with the eye. When medication isn't a viable option, the next step is surgical treatment. The most common surgery for glaucoma is the trabeculectomy, which has a small incision made in the sclera of the eye for the aqueous to drain into a little bleb and then be reabsorbed by the body. This carries a relatively high risk of morbidity of 10 to 15% and a 5% chance of infections such as blebitis and endophthalmitis, which can be serious enough to lose more vision or even the eye itself. Because trabeculectomy procedures make another mode of aqueous outflow in the eye besides the trabecular meshwork, there is a risk of intraocular pressure falling too low and causing a post-operative choroidal hemorrhage, which can further damage the patient's vision. The new advancement for the treatment of glaucoma that I have chosen is a trabecular bypass surgery. This new procedure differs from other current methods by utilizing the pre-existing mechanisms of outflow in the trabecular meshwork and creating only one point of outflow for the aqueous. A new implant was devised made up of medical-grade silicone, with a distinct inlet section in the anterior chamber of the eye, connected perpendicularly with a lumen to an outlet section in the exterior surface of the trabecular meshwork, which makes use of the back pressure of the aqueous, thereby reducing the possibility of intraocular pressure falling too low. When implanted, the stent will only cross the trabecular meshwork without needing to cross the sclera. This new surgical procedure has significantly lower chances of post-operative complications, such as choroidal hemorrhage caused by hypotony, and rates of infection like blebitis and endophthalmitis caused by making slits in the sclera. The risk of infection is also significantly decreased, from around 5% in modern procedures to 0.05%. Post-operative infections pose a serious problem as they have the potential to cause significant harm to the patient and further degrade their vision. And so, this newly developed surgery and device present a significant advancement in the treatment of glaucoma, by reducing the common postoperative complications that arise from current surgical treatments. It has the potential to improve the quality of life for hundreds of thousands of people suffering from glaucoma, with a much smaller risk than other modern treatments. Thank you.